So good afternoon, everyone, and welcome to MPHA's 2017 webinar series. My name is Becca Bolas, and I am the Executive Director of the Maine Public Health Association. I'm just going to give you a bit of information about our webinar series and about today's talk, and then I'll turn it over to the Maine Cancer Foundation. So the goal of MPHA's webinar series is to feature and promote ongoing public health work in Maine, including accomplishments, current events, programs, and resources. There is much exciting work in our state and much to celebrate. So if you're interested in being featured in one of our webinars, please let me know. We would love to have you. We're grateful to the Maine Area Health Education Center and the New England Public Health Training Center for their generous support of this educational opportunity, which is available to anyone interested in public health in Maine. Shortly, I will turn it over to Maine Cancer Foundation's Director of Programming, Aysha Sheikh, and Program Manager, Heather Drake. And today they will be presenting about Maine's Impact Cancer Network, which is focused on reducing the impact of cancer on individuals and communities in Maine through collaboration and systems improvement. If you have a question during the presentation, you may use the chat feature by clicking on the gray call-out box in the conference call header at the top of your screen. And we'll try to moderate as best we can, but in the interest of time, we may have to respond to questions at the end of the webinar. And if we don't get to your question, I'll make sure that they're forwarded to the Maine Cancer Foundation. They can follow up with you separately if need be. So again, I want to thank you very much for joining us today, and I will now turn it over to Heather.
Good afternoon, everybody. I've just had to see what time it is. It is 12. So I hope everybody has had a good morning, and I want to thank you all for joining us to learn more about the exciting work of Maine's Impact Cancer Network. As Becca said, I'm Heather Drake. I'm one of the program managers at Maine Cancer Foundation, and I oversee the work of Maine's Impact Cancer Network. And so I'm joined by our Director of Programming, Aysha Sheikh, and she's going to give us all a little bit of background on Maine Cancer Foundation and the work we do, as well as how Maine Cancer Foundation became involved in the collective impact framework. And then from there, if anyone's not familiar with collective impact, I'll go over what that is. And then the bulk of the presentation will really be focusing on our listening report and our common agenda that we just promoted and got feedback on at our conference that we held last Thursday. So if you were at our conference, it might be a little bit more of the same, but I think it's important to, hear about this information as much as possible, to digest it and think about it and really think about where we need to focus. So we hope that we'll be able to spend some time today enabling you to react to both the listener report and the common agenda. And then we'll close out the webinar with a series of our next steps in ways that you all can become more involved. So right now, I will turn it over to Aysha, who will talk about our work here at Maine Cancer Foundation.
Thanks, Heather. So this is Aysha. I'm the Director of Programming here, which means that I work with Heather on collective impact work happening here at the Foundation, as well as all the grant making that happens at the Foundation. I just wanted to take a moment to talk about the Foundation itself for any of you who may not be familiar with our work or mission. Our mission is that we are 100% dedicated to reducing cancer incidence and mortality in Maine, and all of the money that we raise for cancer, reducing cancer in Maine, it also stays in Maine with our programming and also Maine-based organization. In 2015, the Foundation chose to launch a Challenge Cancer 2020 initiative with the goal of reducing cancer mortality in our state 20% by 2020. As part of that work, we are focused on 3 different initiatives. One is to increase cancer prevention in Maine, as well as increase cancer screening testing in Maine, and to improve patient outcomes. And so as part of that commitment, we've dedicated $15 million over the next 5 years to improve our outcomes. I want to take a moment to just talk a little bit about how Maine Cancer Foundation was introduced to collective impact and why we've chosen to follow through with this work. In 2015, we started to think about Maine overall and how our different organizations work together and how we can reduce the effect of people working within silos and really create system-based change, statewide change, and increase collaboration with organizations. As part of that, 2 staff members, including myself, attended a conference in Vancouver hosted by the Tamarack Institute, and we're really excited about what we heard and believe that collective impact was exciting, but also that it was a really good fit for how organizations work together in Maine. And so as part of this work, in May 2016, at our Challenge Cancer Conference, we introduced the idea of collective impact and heard a lot of positive feedback about this model and the desire for people, our colleagues, to learn more and to work more together to reach our common goals.
All right, so this is Heather again with all that talk about collective impact. It's helpful to know what the framework is. And so I think it's one of those concepts and frameworks that seems simple in the outset, but there are several moving parts, and it's also an ever-evolving process. So even as we go through our work here, we might set goals, we might set timelines, and as different issues come up or topic areas, those will definitely change. So I just want everyone to be aware that as we do this work, it's not all set in stone. Yes, we are really trying to follow the framework as much as possible, but also recognize that it can change as we go. So what collective impact is it's really a framework for making large-scale systems change through collaboration. So it's basically looking at all of the great work that people are currently doing and identifying gaps that need to be filled while coming to a shared understanding of a problem. And then it's working collectively, taking what we're already doing and what we need to be doing and moving that towards this common vision for making the systems level change. So as you can see on your screen, there are 5 key elements to collective impact. And the first one is the common agenda. So if you were at our conference last week, you learned about our common agenda. If you weren't, you'll hear more about it today. And a common agenda is really a shared vision for change, and it's a common understanding of the problem you're trying to address. So for us with the Maine Impact Cancer Network, what we're addressing is cancer in Maine. But it's really understanding what the problem is just beyond cancer. So we spent the past year beginning at our conference last year in 2016 all the way up until April of this year, hosting community conversations and listening sessions to really hear about what's happening in people's lives with cancer and how we can work better collaboratively to make change happen. And so the conversations not only served as an opportunity to gather information, but it was also a chance for us to build relationships with stakeholders and for stakeholders to build relationships with each other. And the collective impact framework really puts an emphasis on bringing together 4 different sectors, and those sectors are lived experience. So in our case, it's lived experience with cancer, and that's generally either a survivor or it could be a caregiver as well or a provider. It also includes the nonprofit community, the business community, and government representatives. And so in having our community conversations, we really tried to make sure that we had a diverse group of people, but we do recognize that there were probably audiences that we were missing or some were more represented than others. So as we continue on, we're really hoping to continue these conversations and information gathering so that we can work toward what will ultimately produce as a community plan more effectively together. So the second element of collective impact is a shared measurement system. And this is really a means to collect data, to create accountability among people who are working on the project, and to track our progress and assess and reassess if needed. So we currently have a data team of 4 individuals. who will be working with our leadership roundtable, which is our governing body of Maine's Impact Cancer Network, and as well as task forces, which will soon be created to identify measures and baselines to track our work as we move towards the common agenda. And the shared measurement system is also something that we're working on figuring out what it will look like, and the data team will help us with that, but it will be some warehouse or clearinghouse where we can see how we're doing with our measures and our work and how we're best working together. So the next element are mutually reinforcing activities, and these are activities that are already taking place. So those are things that organizations are already doing and already excelling at, but do contribute to the common agenda or can be easily adapted to contribute to the common agenda. So if you just think about your own work right now, that could very well be classified as a mutually reinforcing activity. So as I mentioned, we'll be continuing to have conversations. They might not look entirely like they did this past year, but we really want to continue to build these relationships and build trust amongst each other so that we can keep everyone updated on the work that's happening and really connected in order to share best practices and resources. And lastly, the backbone support role is the role that Maine Cancer Foundation is currently taking. And so we are acting currently as the sole funder and the convener and coordinator of all of the collective impact work. But ideally, as our work moves forward, we're hoping to be joined by other funders or financial supporters who can help us create more of a collaborative backbone and will eventually hopefully become just more of a seat at the table as opposed to the main facilitator. So that's collective impact, and do feel free to, send questions as they come up. I know sometimes it's hard to take note of them and then remember to ask them at the end of the webinar, but I'll do my best to answer them as they come in. What we'll do now is move into the listening report. And so the listening report is basically a synthesis of those community conversations that I mentioned that we did throughout the state over the past year. And we did all of these community conversations to create that shared understanding of cancer in Maine, to build relationships with all of you and you with each other, and to create that trust to be able to better to work together as we move this work forward. And so this is the why and the who of the listening report, but I'll also go through a summary of each of the 3 questions, and then at the end ask you all to pick out what stood out to you or if there's anything missing. So again, as I go through this, feel free to send questions. So as I mentioned, beginning with our conference in May of last year, we listened through April of this year to about 670 people who represented those 4 sectors of lived experience, nonprofit, business, and government. And we did this through community conversations, one-on-one interviews, and also a survey. And we also received some help from partner organizations who had held their own listening sessions or community circles about cancer in their regions. And so they very nicely provided the notes from those to help contribute to this rather than ask people again to go through another conversation. So while we know that not all the groups were represented equally, we did really try to do our best to hear from as many different groups as we could. And as I've been mentioning, we'll continue to engage people. And if there's someone at the table or someone who's not at the table that you think should be involved, please, again, let us know, because we really want to make this as collaborative and inclusive as possible. So this is the synthesis of our listening report, and we asked 3 questions at all of the community conversations and in our one-on-one interviews, and more or less in our survey, but they were a little more close-ended for our survey. But the 3 questions we ask are: what is happening with cancer in your personal or professional lives? What are the changes you would like to see with regard to cancer? And how can we work together to make these changes happen? And so what I'll do now is go through the key findings of each of these questions. And again, at the end, I'm going to ask you to pull out some highlights. So take notes, and we'll try to make this as participatory as possible as we can. So our first question, what is happening with cancer? Many of the conversations tended to focus on the work that we need to do or the gaps that need to be filled. But there are also several successes and things that are going really well in the state that were brought up. I think every single conversation highlighted that people feel part of caring, supportive communities. People really feel that they have neighbors that they can call on for rides, for help, making meals, to just talk. So that was something that was really important to people, and I think is really representative of who we are as a state. Groups also highlighted that there are several transportation assistance programs throughout the state, and that there is a lot of free cancer screenings available that people have access to depending upon which region they live in. Participants also appreciate the support that they receive from cancer community and resource centers, and the benefits of being able to participate in support groups. And that was mentioned for both survivors and people with cancer, but also their caregivers as well. And there's also a great deal of prevention promotion happening within the state, so another really good highlight. But again, as I mentioned, along with these successes, participants also highlighted several barriers, challenges, and gaps with what's happening with cancer in Maine. So I will, pause on each of these slides to let you take it all in, because it is a lot of information, but we really wanted to be true to what we heard and include it all. So those that were most common in the conversations that we heard are listed on your screen. And I will, I think, ask Becca if she's able to include a link to our listening report, which includes a summary of each conversation if you want to hear what specific groups said. But what came up as barriers may or may not surprise you, given how rural our state is. Access to transportation and care were concerns by many in many of the conversations. And many people also focused on the lack of collaboration between the several health systems in Maine, and also within and between the public health system and other health resources. So collaboration was a big topic. Several people would like to see access to palliative care throughout a cancer diagnosis, and would also like the opportunity to be offered holistic or alternative therapies. But another common theme that we heard throughout are that there are confusing prevention and screening guidelines that may either vary between health systems or providers, or that change on a national level. And I think that's something that we can all relate to. Participants thinking about education highlighted that there's mixed messaging that may occur in school settings in terms of prevention to young people. And so an example of this was that a school might promote the Let's Go initiative, but also still use sugary foods as a reward or take away recess as a discipline. So that mixed messaging, sending it to kids. And many people in a lot of the conversations also cited a lack of public health funding, and just inconsistencies with the public health infrastructures that currently exist. And lastly, another big topic was the inability to pay for care. And this seemed to be for many who may not have health insurance, or even if they have health insurance, there's a lot of confusion over what's covered in their insurance and when care might move from prevention, which is covered under insurance, to care that's diagnostic and may or may not be covered. So I'll just take a second there and let this sink in, give you time to digest. I know it's not always easy to hear so much information in a short amount of time. So we'll move on to question 2 that we asked, and those are the changes that we would like to see. So this could be anything from, very realistic, concrete changes to sort of pie in the sky wishes. One thing that we commonly heard was, well, if you just got rid of cancer, everything would be solved, which is very lovely, but also not really one of those things that we can address immediately. But again, we wanted to include everything. So what I've done in this section is I've started to group the changes into the 5 key themes that ultimately emerged from our conversations. So we'll start with healthcare system collaboration, which, as I mentioned, under What's Happening, this is something that people were really vocal about. So collaboration within the healthcare system and between providers came up in many of the conversations as a barrier. So people would like to see it changed by increasing collaboration and information sharing, specifically as it relates to sharing medical records and obtaining referrals between systems and providers. And many people also perceive that the health systems put their profit margins first and not patients at the center of care. Several of the conversation participants don't believe patients receive enough information on how to be part of clinical trials or that there's even access to them. Moving outside of the health systems, participants would like to see there being more work groups and forums specifically on cancer topics to help cultivate more collaboration and get people thinking, talking, and working together. So that really felt good doing this work to know that people are on board with that. When we talked to educators and students, they were particularly keen to increase interprofessional collaboration, beginning in their post-secondary training and thinking really more globally about how medical professions can work better together. So our second theme is access, and this is thinking both about access to transportation and access to care. So although there are several different travel modes and abilities to access transportation, people would like to see more connectivity between these travel modes. For example, someone living on the island may be able to take a ferry or a water taxi to the mainland, but once they get there, they don't have a car or an ability to get from the ferry terminal to their medical provider. People would also like more opportunities to engage in ride sharing amongst each other, and for there to be regional transportation centers. In terms of accessing care, people would like more mobile health clinics, bringing care to people, telemedicine opportunities, screenings offered in non-health settings, and more care coordinators and patient advocates. Our next key theme is education. So we started talking in some of the conversations about education and cancer prevention for youth, and it was really important for some to increase the social and emotional learning and youth empowerment that happens in schools. So that's focusing more on helping youth make decisions and think critically about what they're doing and how they're feeling and how to process their own emotions as a way to prevent substance use, specifically tobacco in the case of cancer. A lot of the people in the conversation talked about how they perceive providers as not having enough time to listen to them and to really be compassionate about what's happening and what their needs are. So people would like to see more education for providers on that. We talked to some specific groups like the LGBTQ+ community, tribal populations, New Mainers, even youth, and they would like to see more messaging that's targeted specifically to their group. And there was also a good discussion about health literacy and how not all of the information that patients receive, whether it's information that they receive through a provider's office or that they hear on TV or through messaging and advertising, is really something that they can comprehend. So it's important to put any messaging that we do into more lay terms so that people can understand and digest it. There was talk that there needs to be more education on environmental exposures and risk factors, and that doesn't always get the same level of attention as some of the other cancer risk factors. And then lastly, people would like to see an inventory of statewide resources. People are aware that there are resources out there, but don't necessarily know what they are, maybe specific to their region or their locality, and would like to see more of those. Our next key theme is advocacy. So this came up a lot. People would really like to see there be more education of our policymakers on cancer prevention, detection, treatment, and public health. They would also like to see more funding for prevention, treatment, and research, and cost transparency. And folks would like to see Maine Care expanded so people have more access to care through greater access to health insurance. And then related to cost transparency is drug pricing controls and more drug assistance programs. Lastly, the conversations talk about survivorship. And overall, people want to see more supports in place for both youth and adult survivors and caregivers. And there were several discussions on the need for more mental health counseling and thinking about those topics that might not necessarily be brought up among cancer survivors, like returning to work or sexual relations. How do you navigate that? And even for caregivers too, mental health counseling, where how do you deal with a loved one who may have a cancer diagnosis while also trying to deal with your own feelings. And lastly, a big topic that came up in several conversations was being able to access palliative care, not only towards the end of a diagnosis, but throughout a cancer diagnosis as well, and the importance of that. So our last question that we asked is, how can we work together to make change happen? And so the way this differentiates between the last question is that we were really hoping that people would begin to think critically about other stakeholders that either needed to be brought to the table or we could work with to make change happen. So the next few slides are part of our common agenda, and we are referring to them as the ideas for implementation. And I'll go through the same themes that I just did, thinking first about healthcare system collaboration. And so there will be a lot on these slides coming up, but I'll try to just pick and pull a couple of the different topics that were most prominent in the conversations or those that really show collaboration. But again, if you have any questions or highlights that come up about these, please feel free to ask them as we go. So one of the ways that people think we can work better together and to make change happen regarding healthcare system collaboration is to increase collaboration between health systems and cancer resource centers. So in some of the conversations we heard that a hospital might have rules on who can advertise or put advertisements up on their bulletin boards, so then patients aren't able to know about what's available in the community. So if there was a better collaboration there, there could be more cross-sharing of information. Again, touching on the interprofessional education within the healthcare fields. And so what I mean by interprofessional education is getting medical students or current providers working with physical therapists or occupational therapists so that everyone has more of a baseline understanding with cancer competencies and how their different disciplines can work with each other. We spoke to a group of physical therapy and occupational therapy students and pharmacy students, and they had expressed that they don't always know how to treat a cancer patient when they're in their residencies because they're not exposed to it as much as they would like to be during their training. So getting those groups working better together. And there was also talk about collaboration between healthcare providers and employers. So how can we get more mobile clinics to bring screenings to employees? So thinking about currently we might bring a flu clinic or vaccination to a large employer, but why couldn't we do something similar with mammography or another screening that would be accessible through a mobile health clinic? So those are just some of them on that list. But in the recognizing our time, and we're halfway through, I'm going to keep going. The other topic and theme was access, and so I've broken this slide down into both access to transportation and access to care. So these are sort of the funny pairing, because if we solved access to care, we might not need to think about access to transportation as much. But one of the topics that came up a lot was bringing ride-sharing services to rural Maine, so thinking about Ubers and Lyft and how we could use those organizations and entities to get patients to their care. Because while there are currently shuttles that exist, those aren't always conducive to a person's schedule, especially if you're undergoing cancer treatments or you're not feeling well, to have to take a shuttle for your 8 a.m. appointment and then stay at your provider's office until the next person on the shuttle finishes their 2 p.m. appointment can be really taxing on you if you're going through treatment. Another great idea that we heard that I think is currently in the works is including a comfort room at ferry terminals. So if you live on the islands, and this could be used for someone who's going through cancer treatment or just needs a quiet space, that there would be a room set aside that you could utilize while you wait for your ferry to come or your ride to your provider. Looking over at the care category, this was really focusing on just increasing the number of providers that are available in the state. Many people love having patient navigators and community health workers, and so how can we increase those more? So while we didn't think too critically on the specifics of these, it's really important that there are more specialists, that there are more providers, especially in these more rural areas, so that patients can get the care when they need it and in the comfort of their own region. And I should point out too, this came up at the conference, is the emphasis on financial navigation and how people need those supports when they're going through a cancer diagnosis on how do I, balance my regular bills, my heating, my groceries with all of those that are happening with my cancer treatment. Our next topic is education, and this really covers the gamut of everything from K through 12 education to educating community members, to educating providers, to even employers. Some of the human resources departments we talked to didn't necessarily have the knowledge of how prevention creates a return on investment. So what are different programs that we can set up for those HR departments so that they understand the benefits of promoting screening among their employees? Another really neat idea that came up was to work with realtors on spreading messaging about radon detection and mitigation. People really love the Let's Go program and would like to see that not only increase in schools, but also in physicians' offices and into the adult population as well. When we were thinking in the last slide, we had talked about there not being an inventory of cancer resources that are available. Are there ways, thinking critically, that we could collaborate with systems like 211 to also provide cancer resources, or perhaps create a sister organization that would be comparable to that, but exclusively to cancer? Our next topic is advocacy. And so this is really, and thinking about how can we work together, it really comes down all about to advocating and making our voices heard more. We did speak to some Maine legislators throughout the conversations, and what they had suggested in talking to them is to really focus on one issue or topic at a time, so as not to confound the points and what we care about with them. So I know that that's often hard in public health and healthcare because everything is so related. But if we're presenting all of our information at once, that can tend to water down what we really want a legislator to do or to support. And the other suggestion was to make sure that we're providing not only information on the issue, but also data that supports outcomes and personal stories as well. Lastly, our last theme, again, is survivorship. We talked a bit about, in our conversations, about the need to support employers. So that's not only are employers able to support their employees who may have a cancer diagnosis come back to work or work throughout their diagnosis, but also how can employees better advocate for themselves. So there are different websites like Cancer and Careers that are out there, but people just might not know that they're a resource. We talked to some youth groups, and they really focused, the group of young people we talked to were mostly those who were affected by cancer, but didn't necessarily have cancer themselves. And so they would really like to see more social work support for youth and more guardianship support. So if they've lost a parent or both their parents, how can they get that support to help them navigate who they end up living with? And then increasing the number of cancer support programs and increasing the number of cancer community and resource centers. So how can we better work with those community and resource centers that already exist to expand those to various areas of the state? So that was a lot. I need to take a sip of water, but we will move on to a question that I have for all of you, is that what stood out in the listening report? Is there anything that you see as a highlight, as something that might not belong in the listening report? I'll give just a few minutes if anybody has anything that they want to share. And we asked these same questions during the conference last week as well, and I have to admit I have not gone through all of those notes yet, but anything that comes out today I'll be happy to share in our final report.
To give feedback this is Becca. I was just going to say that to give feedback to Heather, you can use the gray call-out box if you're viewing this online. You just click that box and you can type in your feedback. If you are on the phone, it may be best to follow up because I'm not quite, I can try to unmute the people on the phone and see how that works. Maybe that is what's best. So I'll unmute the phone folks. So if you want to give your feedback that way, that might be best.
All right, I'll go ahead and move on, and I might skip the next question just so we can get through everything, and then we'll save some questions for the end. But just think about whether or not we missed anything in the listening report. And again, if something comes up, and I'll be sure to provide everyone with a hard copy if you want to look through it a little bit more thoroughly, to reach out to me at any time, and I'll include my contact information at the end of the webinar. So what we did was we took all of the information from the listening report and we turned it into our common agenda. So our common agenda, you can think of it as the goals and strategies in order to reduce the impact of cancer on individuals and communities through collaboration and systems improvement. So our first one focuses on the theme of collaboration, and that's to increase interprofessional collaboration within and between the health system and between providers so that patients may more easily navigate their health care. And that's talking about both health systems and providers, and those ideas for implementation that we just went through are what would go under these. Our next item is increasing access so patients are able to get the care when they need it, and where. So we talked on those previous slides about increasing access to transportation, ways to increase access to healthcare, and also how to increase, more specifically, the number of patient navigators and the community health worker model throughout the state. Our third common agenda item is focused on education. So that's increasing education on cancer prevention, detection, and treatment so that people are able to make better informed decisions about their health. We want to make sure that people are utilizing evidence-based prevention and screening messaging, that providers are getting education, thinking about cultural competency, compassion, listening, that all providers know about cancer care and have basic competencies, providing education about cancer prevention for K-12 students, and increasing the awareness of existing cancer-related resources. The fourth common agenda item is related to the advocacy theme, and that's increasing cancer advocacy efforts in order to implement public policy to protect Mainers from cancer. So our strategy is to raise awareness of cancer issues among our Maine legislators in order to change policy to support cancer prevention, detection, and treatment. And then our fifth topic and goal or objective is to increase the appropriate types of support for cancer survivors so they receive continued priority as they transition through their care. So thinking back to what we previously discussed, that's supporting our businesses, increasing the number of resources available for youth and for adults both who have cancer and who are affected by cancer. So I will just take a couple more minutes to see if there's anything to you all that stood out. Or the next question is whether or not we missed anything. So we do have one question about our interprofessional education one, and that's, did the students or faculty providers in the conversation have any feedback about how to learn from patients, or did the patients have any ideas on how to engage with the health professions? So we didn't hear too many ideas regarding whether patients had specific ideas with how to engage with health professions, but some of the faculty members that we did talk to talked about incorporating patients in with creating curriculum so that they can give more information as to what do providers actually need to know and learning from patients directly that way. But it was more focused on just how can the providers and specifically residents work better together when they're in their training. And I'll move on to our next question, which is if we missed anything, but feel free to respond to either of those, and I'll give, again, just a minute or so if anybody has any questions that they want to send in. All right, you guys are a quiet bunch. Everybody must be eating their lunch. And again, I know it's hard to react to, so don't be afraid to send me things. So we'll move on to I think what most people are typically most excited about, and that's next steps and how to be involved. I hope you're excited about how to be involved. So what we'll do immediately, and immediately is kind of a loose term, but our next step is to write a community plan. So taking the information and the feedback that we received from our conference last week and any that you all might want to send along, and that we hear from our leadership roundtable who's really guiding this work, and we'll use it to write a community plan. So that plan will include a more specific common agenda. We know that we won't be able to tackle all of these topic areas and ideas for implementation at once, but we'll do those that are of highest priority and the quickest wins first, and then move on from there, recognizing that this will be a long-term process. And based on our community plan, we'll create task forces, and we're really hoping that those task forces will be the ones to be active and to move this work forward. And then lastly, we will track and assess our progress through that shared measurement system that I had mentioned earlier, just to make sure that we're staying on track and doing what we need to do to reach our outcomes. And lastly, while this is all happening. We really want to continue to form these alliances and partnerships and make sure that we continue to engage the 4 sectors. In terms of the task forces, we're hoping and striving to have these be diverse collaborations of individuals and organizations. So diversity in terms of the sector, diversity in terms of the region that you come from, your past experiences, your education, that will be committed to advancing a specific strategy that their skills best align to. So we're imagining these task forces to be time limited. So once you've worked on your task, if you want to join another task force, build upon it, that's definitely welcome. But we don't see these groups as ones that will just continue to exist into the beyond, unless, of course, they need to, based on their specific strategy. We want to make sure that all of the work we do is based in evidence. And so we know that not everything is based in evidence, and so if there is a pilot program or a really innovative idea that doesn't have evidence supporting it yet, we hope to cultivate that and to work with groups to make that happen, so that we can find out what works best for our localities and our state. And then lastly, the task forces will support our mutually reinforcing activities, and that's that great work that people are already doing, and how can we make sure that it's contributing. So whether it's something that can be brought to scale or expanded statewide, we'll be looking there as well. The data team will work with these task forces once they're created to select their data and their measures, and they will help us develop that shared measurement system. We're also intending to produce an annual report, which will be just an overview of what we've done in the past year, where we've been, and where we're going. So that would ideally come out next spring. Our Leadership Roundtable is a group that currently we have 6 members, and they provide our overall leadership and our strategic guidance for the Maine Impact Cancer Network. We hope by the end of the year to have increased the size of this group to 10 to 12 people. So if you're interested in a leadership role, thinking strategically, if you have time to commit, please let me know. And this group will support and coordinate our task forces, so collaborate with our data team, continue to increase the membership of the Cancer Network, and also look for additional funding sources to help with the Cancer Network and moving our work along. And then we have continuous communication, and this is one of the last steps that we'll be working on that will also be evolving. We will continue to develop a database of Mainers, so if you're on this call and you'd like to be involved, please send me your information and we can include you. We will be determining a tool for communication, so we want to not only be able to communicate you, which we hope to do through a newsletter, but also for you all to be able to communicate with each other. So whether it's a web-based platform or a listserv, we are hoping to create something to enable that. And then lastly, we'll have some sort of online presence. Again, we're hoping that this can be a way for everyone to work and to collaborate together, as opposed to just a website with information. And we will not, a question just popped up about whether the communication tools would be available both in print and online. The current thinking is that they would only be available electronically, but it would be through email on whatever our online presence is. Currently, we have a web page within Maine Cancer Foundation's website, which we'll probably use for the interim. But if the budget allows and we have more funders coming on, perhaps someone wants to support that financial piece of printing materials. So those are our immediate next steps for the next, 3 to 6 months to a year that we'll be putting together. And we hope that you will join us in this. We have different ways to be involved. You can simply choose to stay informed. You can join one of the task forces, and each of the task forces will be centered around those 5 themes that we talked about. you can express interest in joining the Leadership Roundtable if you would like to take on more of a strategic and leadership role, or, as I've mentioned before, providing financial support. In the beginning, I said that Maine Cancer Foundation is the sole backbone supporting role right now, but we do hope to bring on other funders, whether those are foundations or just folks who are able to give independently, or organizations who can give independently. So that wraps up what I have about to say. And so we have about 10 minutes left. I can turn it over to Becca if there are any questions. I think you can use the chat box. Or again, I'll put up my email address and phone number if anyone wants to reach out that way.
Thanks, Heather. Do you have any specific requests for the folks that are on the webinar now in terms of following up with you or helping with connecting or networking? Is there any kind of action item you'd like from them?
So right now would just be, I think the most immediate would be sending me your information, or if there's any way for you, Becca, to share information with folks, and I'm happy to put you into our database and get you involved so that you'll receive our communications later this afternoon. I'll be sending out a recap of the conference and what happened that day, so people will have access to the listening report. So I think another next step would be, and I'll provide this as well, to listen to the listening, or to read the listening report and look through the common agenda to see where your skills and your expertise can best help us move this work along. And tell us too what you're currently doing. If there's a project, maybe it's something that I mentioned that was an idea that came up that you're working on, it would be really helpful for us to know. We definitely don't want to duplicate any efforts. So if we can learn from best practices, we're really hoping to do that.
Yeah, I mean, MPHA can definitely share that information, so we'd be happy to. And for everyone who's still on the call, you'll be getting a link later today to the webinar, and I'll include in there the resources that Heather's talking about, so you can see them and then share them within your networks as well. That's great. So I think we'll give it just one more minute. If you do have any questions, you should be able to unmute yourself if you're online, and or use the chat box to type in your question. If you're on the phone and do have one, then Heather's email is very easy. It's just heather@mainecancer.org. So you could call her and or email her and let her know your question. So I'll just wait maybe one more minute, and then I think that'll be it. This was a great presentation. Thank you so much for all the work that you're doing.
Thank you for having us. I hope it was a good opportunity for everyone to learn a little bit more.
Yeah, absolutely. Just give it one more minute and we'll see, and then we'll finish up. All right, well, I think then that'll be it. So I want to thank you all very much for taking the time to join us today, and I especially want to thank Heather and Aysha for their presentations, and to the Maine Cancer Foundation for all their work. And again, just want to thank the Maine Area Health Education Centers and the New England Public Health Training Institute for their support of our webinars. Our next webinar will be in June. We don't have a date yet, but I can tell you the topic will be about clean water access in Maine. And you'll be getting an email, save the date from us once we have the date nailed down. So again, thank you very much for joining us, and we hope to see you on a future webinar.
Thank you.
Thanks.